So good morning, everyone, and welcome to Forward Friday. Forward Friday is a series that we have been doing throughout the 21-day Racial Equity and Social Justice Challenge. Every Friday, we have a conversation with a community leader or someone who's experiencing the challenge to discuss the topic at hand in the week and to really have a deeper dive conversation around how that topic resonates, not only within their industry or with themselves, but also talk more in a forward-facing view as to how we as a county, we as people are dealing with that topic in our everyday life and just unpacking it. So today we have with us Janisse Schoepp. Am I saying that right?
Yes.
Janisse Schoepp, who is the Vice President of Operations and Strategy at the Health Foundation of South Florida. Thank you so much for joining me, Janisse. I appreciate it, and I appreciate your name being pronounced like my mother's name, Janisse, not Janice. And we clarified that the other day, and I thought it was just so sweet. And I was thinking about it last night. I actually told my mother, I was like, I met another Janisse. And she was very excited about that. So.
That's awesome.
But welcome. I appreciate you being here and spending a few minutes with us talking about community health and public health, and why is it that this is such a major racial justice issue. I also want to say the Health Foundation of South Florida was the first funder to step forward and say, we want to support the work of YWCA as a legacy organization focused on racial justice issues in this county. Actually, I might be lying, the Miami Foundation and the Health Foundation of South Florida were the first. Can't remember, you might have been hours apart.
Good company.
Good company, extremely good company. But what that said for us as an organization, but more importantly, what it said in your public statement, in the public statement from the Health Foundation, was not just we're supporting these organizations, but you spoke about what we did and you encouraged others to join and do the same. It wasn't just about making a blanket statement, but it was about actionable items that the Health Foundation was going to hold themselves accountable to. And I want us to touch on that at some point in time today. But from that point, explain to me why it was so important and why you saw fit as a health foundation to support YWCA and the Urban League of Broward County in that first statement that you issued into the universe a couple months ago.
Yeah, well, good morning, Kerry-Ann, and thank you for the opportunity today to have a conversation with you around a topic that has been important to the Health Foundation, I think, throughout the years, but ever more important now than ever to the work that we're trying to achieve in our community. I think that you stated that in our response statement, it was important for us to not just say we stand in solidarity with our Black populations and so forth and others, but that we really took the time to think through what can we do different as not just individuals, but as an organization, as a philanthropic institution. And one of the very first things that came to mind is how are we doing in terms of supporting Black-led organizations that have been doing this work for years in our community. And so that was just a no-brainer. That was just a starting point for us. We have always respected the work of the Urban League of Broward County as well as YWCA, and we saw that as a natural fit to what we were trying to achieve and to the journey that we're really starting, I would say, in being more intentional about supporting, partnering, and working together with Black-led organizations. There is something to be said about philanthropy, and that's we've been very top-down. Our history kind of shows that we have approached our work in a way that has not necessarily given an equal footing to our partner organizations. And that is something that we've been working on, thinking about those that we're trying to impact having a voice within our own processes or funding decisions, and having ownership of what it is that we're trying to achieve in their communities. And so, like I said, I think YW is obviously a lead organization in our community, and is poised to advance the work around racial equity and social justice.
Thank you. I appreciate that. Folks might not be connecting the dots, and I think they did this week because our topic this week was public health. And it's a major racial justice issue.
Mm-hmm.
Help us to connect the dots, because one of the powerful things, and not only once, but 3 times was said in your response statement from the Health Foundation,
right,
that racial justice and racial inequity, racial disparities, however you choose to, racism at its core is a public health crisis. This week, we unpacked a lot of the reasons why that is, but can you tell us from your point of view, why is racism a public health crisis?
Yeah, it's a very complex answer. And we're seeing that, I think, this week during the YWCA challenge, because there are so many different factors that have gone into structural inequities across all of the different sectors that impact health. I would put it in simple terms, and that is, when you think about the statement that where you live or your zip code determines how long you live, that right there is a result of a history of policies that have been rooted in social segregation, right, or racial segregation. When you take a community, or when you take place, right, and you think about whether people have access to healthcare, access to healthy foods, access to a community that feels safe, access to quality housing, access to quality childcare, education, job opportunities, transportation, you name it. All of these social and economic indicators of health are rooted, again, in disparities that have resulted, once again, from policies that date back to when that date back to historical decisions that were made by our government that led to segregated communities. And so, that is in essence what we're seeing today is the result of years of this racial segregation, and how that impacts the chronic disease burden that we see in our Black and Hispanic communities. I would say that no matter what health issue you look at, diabetes, heart disease, now with COVID, everything is just shedding light into these racial disparities, where Blacks are just having a disproportionate burden of hospitalizations and death rates. Just take, again, the COVID example. And so, it's like peeling the layers off an onion, right? You start looking at, well, people are unhealthy because of their individual behaviors. Okay, well, we learned a long time ago at the Health Foundation that we could be educating people to how to eat healthier. You need to eat your fruits and vegetables. You need to go out and exercise. But then it's like, well, what does the environment look like for that person or individual if they don't have a grocery store where they can purchase that affordable fresh produce, or if they don't feel safe and going outside because there is violence, right, out in the community, and there's not a safe environment to support that. So we have, I think, really taken a step forward in supporting policy and systems change. I think that really is at the core of what we're trying to achieve at the Health Foundation, and have become more intentional. I think that's really the word that we've been using, more intentional around understanding what is really at the root of a lot of the disparities that we observe. And it all points back to racism, and structural racism in particular. I mean, this week, I have to say that you have challenged us because when I started the YWCA challenge, I was like, well, you know, I'm pretty familiar with
Mhm.
the structural inequities that are in healthcare, public health, right? That's my academic background. And so you have things like the Tuskegee syphilis, you know, study and
Yeah,
so
yeah,
forth.
yeah.
And oh boy, was I, you know, proven wrong, because even within the sector that I am, you know, most closely familiar with, which is public health and healthcare, there are things that I didn't know. I think one of the articles today, or one of the videos today, was focused on the Negro Project and the efforts to around sterilization
Mhm.
for Black women, right? And
Mhm.
so, you know, when you think about the structural inequities across all of the other sectors, education, you know, transportation, housing, criminal justice, um, that is really what is driving a lot of the statements that are coming out and the declarations that are coming out from a lot of leaders saying,
Mhm.
you know, racism is killing Black people.
Oh yeah.
Uh,
And it's
and
so interwoven at this point.
yes,
It's so
connected.
tightly connected that I think there are so many people who, if we don't educate ourselves and if we don't allow ourselves to be challenged, would look at it at face value and would say, but there's an Oprah and
Yes,
Barack Obama. So what are you talking about? Anyone can
yes,
achieve the highest of heights in the American dream. But we're not talking about the outliers. We're talking about the average everyday person. And when
yeah,
you look at the statistics and the averages, and you have to understand the minefields and the history and the weights on people's legs that they enter the race with. And those weights are historic, they are racial, they are structural. And we have to acknowledge those, right?
right.
So, with that in mind, tell me, you know, first of all, give us a little snippet into kind of a day in the life of the Health Foundation previously, and then let's kind of talk about this intentionality, because intentionality is a really important word in this. Because when we talk about the shift from saying I'm not a racist to being an anti-racist,
Right.
difference, whether it's structural or personal, is intentionality. The
Correct.
difference in understanding that we have implicit bias that's
Yeah.
built within our bodies, within our brains were wired that way, and that implicit bias also shows up systemically and then takes on rules and regulations and policies that after a while we forget how we even got there. But
Yeah.
we realize by looking at the outcomes, by looking at the numbers, that, ooh, something's not right here. Then you have to peel it back and understand what got you there. So that word intentionality is really important. But I know that this is not a new concept to the Health Foundation. You have recognized social determinants of health for a really long time. That's been the cornerstone of your work. So how how has Health Foundation worked, let's just say in the last 2 or 3, 4 years, around social determinants of health? And then if you could pivot and kind of tell us what other organizations like yourself and through the lens of what you're doing could be doing next to become better, hold themselves accountable, and play space in this racial inequity work. So that's 2 questions, and any rule of
Yeah.
everyone tells you not to do that,
I want to go back to the last one just for a quick moment.
go for it.
All right. Because you mentioned something about the daily life, right? And it's kind of a personal experience that I had where, you know, we began to have some conversations internally after the murder of George Floyd, to provide a safe space, right, for all of us to talk about how we were feeling, our emotions, hear from our Black colleagues about their experiences. And one of the things that I you know came to the realization about is that I will never understand what it is for me to walk in the shoes of a Black individual, a Black person in our community. Um, and I am Hispanic, I am Latin, I'm Caribbean, whatever, you know, you want to classify me as, but I've never really felt discriminated against. So I don't have that lived experience. For the one instance where when Hurricane Maria hit Puerto Rico, we were in the news, you know, our president went to visit, he threw paper towels, you know, to a group of Puerto Ricans. And so that kind of started a whole debate around that particular incident. And I was just curious, and I started to read through the comments, right, on that news article. And the comments were very negative towards Puerto Ricans. You know, I'm not going to mention or repeat them, but it was the one time where I felt less. It was the one time that I kind of did not feel respected, or my dignity, right? It did take an emotional toll on me. So can you imagine having to feel that every single day? I was looking at some of the statistics, and it was like a Black adolescent has about on average 5 racial
Microaggressions.
discrimination, a day. And so that chronic stress takes a toll on both your mental and your physical well-being. Right? And there's more research that's coming out that is basically just supporting the statement that we just talked about, that racism is a public health issue. I think I'll end with this, and that's that, again, going back to one of the articles that was shared this week, basically was comparing the 5 years ago. Like 5 years ago, this researcher was saying, okay, poverty is a public health issue, and everybody agreed with that, right? And then it was like, violence is a public health issue, and about half of them agreed with that statement in the audience. And then when he mentioned racism as a public health issue, it was like no one agreed with that.
Crickets.
Yes. And so basically he ends by saying we're in a much different place today than we were 5 years ago. And I think that, you know, kind of is a good segue to your question. It's like, what have we been doing as a foundation that's different? And I would say, you know, like any other foundation, I think we've had to shift and pivot in some way, shape, or form. But as you alluded to, you know, our mission has always been focused on helping the underserved. But 2 years ago, we began a strategic planning process, and we said, you know what, we need to be more explicit with our values, our guiding principles, and make sure that there's no question about what it is that we're trying to achieve here. And so even our mission statement changed, and there's 2 things that changed. We said, yes, we want to improve the health of all South Floridians, but with a special focus on vulnerable low to moderate income populations. And we also transitioned into understanding that we need to change the policies and the systems that impact health. And so that is now embedded within our mission. We also looked at, okay, what does, you know, what are our values? And I think all of our staff would understand that we work, you know, our work is focused on health equity, et cetera, but we never really made that explicit. And so there are challenges to that, because sometimes if you don't make something like that explicit, operationalize it differently, right, across your organization. And reviewing a project, an investment, a partnership, we are asking ourselves, are we advancing health equity with this? Are we addressing health equity? Are we addressing health disparities? And that's a question that we perhaps did not do on a, you know, on a routine basis, right?
That gut check, that real
gut check, yes.
In time gut check.
Yes. And then, as you said, I think we've, you know, we're about to launch a new strategy that is very heavily focused on the social and economic factors of health. You know, obviously increasing access to healthcare is a key determinant. But we're also looking at how do we integrate social needs into clinical care, and then how do we improve the economic well-being of our residents, and more of a, how do we create a local inclusive economy, which is the goal of our South Florida Anchor Alliance, and getting engaged in the housing conversation.
Mm-hmm.
So those are issues that we have not historically or traditionally been involved in, but have been for the past 2 or 3 years, really getting ourselves up to speed on what is the role that we can play and how can we advance health by working with these sectors in a more collaborative way.
I have to tell you, many years ago, my first iteration of learning about this work was through the Health Foundation. You might remember, way back when. And I remember when I first got into the work, I thought my mind was blown because I was like, this is fascinating work. That was when we were looking at corner stores and how corner stores contributed to the health of a community, because that's where food access was taking place, right? Kids, families, there might be some supermarkets or what would we call them, where they would get some vegetables, like some farmers market kind of scenarios in the area. But for the most part, some of the day-to-day pickups and where especially teens were eating was coming from the corner stores. And it really opened my eyes in understanding the macro issues and economic drivers that create communities, that create choices, that create safety, that create health, and how all of that fits together. What's hard for folks, and I think it was hard for me at first, and probably hard for some folks that are listening today to understand, because we use all these great terminology, we have all these great words that we all understand and we use all the time, is it's messy work. Like, working with people every day is very different from sending out a survey and checking a box, right? Getting those you respect that come to the table fully empowered to make choices in their own lives, to be a part of understanding where we want to help them to change some of their health outcomes, but that we have to make that journey, not for them or to save them, but with them. That work is not work that's done in a silo. It's not a one and done. It's a constant, ongoing, melding scenario of getting people to buy in to their own health outcomes and understanding how everything that's happened around them has gotten them to where they are and how they can change that. What I love about, and I'm just going to talk about my YWCA because I can, but what I love about this work that actually brought me to YWCA is because that's how we approach racial justice. That's how we've always done the work. And we are an organization that does racial justice. So racial justice isn't something you point at, it's something you do. And I took from that experience the fact that these social determinants, and we have to focus on economics, especially now post-COVID. We're looking so deeply and extending and expanding how we can recession-proof and repression-proof the people that we know are being decimated right now. And when those unemployment checks run out in another few weeks, we're going to have a very, very difficult situation on our hands for an entire community and sector of people. Women are disproportionately impacted, and people of color are disproportionately impacted. Why? Because we're either in jobs that we can't stay home, or we're losing jobs because we're in the service industry very heavily, and those sectors are losing their jobs. So our ALICE population, which is one paycheck away from complete disaster financially, they're slipping right off the edge. And we have a responsibility to step in this time. So we're expanding our economic empowerment programs, which mean job skills, job training, placement, introducing jobs and certifications and opportunities to wrap around any kind of barriers that that person would face in order to participate, because we know you're a whole person. You have childcare issues, you have transportation issues. You may, how can I ask you to stop working if you're still lucky to be working? for 12 weeks to upskill yourself or get a certification when you have to work to survive. Those are all things that we have to approach a person's entire lived experience and understand them as human beings in order to address all those roadblocks that have been created because of racial and systemic issues. Mm-hmm. I appreciate and I feel so connected to the work of the Health Foundation because we share and we understand the lens of bringing the entire human being to the table, understanding how history has gotten us to where we are. And with that, tell me now what the intentional lens is that the Health Foundation is putting on to move forward in this work.
Yeah, so one of the things that I would highlight, which I'm pretty proud of our board leadership and you know, Dr. Steve Marcus, our president and CEO, is that we set out to hold ourselves accountable and be intentional about racial equity. And one of the activities that we have adopted is we have created a racial equity committee internally made up of board and staff to basically explore, okay, what is it that we need to do as a foundation? What can we do better? Where are the gaps? Where are the areas of improvement? Mm-hmm. And so where we're being more intentional is, you know, basically starting out with our hiring, procurement, vendor processes and policies to ensure that our policies are not just there in terms of diversity and inclusion, but looking at and assessing where are we right now? What is our baseline? And we're doing the same thing with our grantees. I think I mentioned earlier, you know, we probably will not be surprised at how many of our grantees are representative of Black-led organizations. I think that will be an area for improvement. Even though I would say that we have had some concerted efforts in implementing community-driven initiatives. And so one of the things that, you know, we did in the past few years was this Live Healthy Community Partnership in Miami Gardens and Little Havana, where we set out to have a community-driven approach, increase our capacity of the community to ensure that when a funder, a health foundation, leaves, that the community can continue those efforts. And I think that's something that, you know, we're exploring as a funder. Sometimes funders don't really invest too much in capacity building, leadership development, civic engagement, and we have now integrated those activities or goals as part of our policy agenda, for example, and as part of the tools that we are going to implement as part of our new strategy. And those are things that we did not really, like I said, invest in, except for, I think, this place-based initiative where we piloted really having a shared decision-making process. And, you know, I'll share, they challenged us, you know, in particular, one of the communities where they said, well, you want to be community-driven, these are the issues that we're identifying for our community. It's not the ones that the foundation, you know, listed for us. And also, we want to be part of the funding decision-making process. And that is something that, you know, caught us off guard, but in reality is like, yes, you're right. You should be, as an end consumer and as the community that is meant to benefit from this investment, be part of that process. And that's something that we're going to be looking at more intentionally, is really not just having a policy, because a policy is just a policy. It's actually, how do you operationalize that policy? How do you implement it? And then
what's that policy look like day to day?
Correct. And really setting some equity metrics to keep us accountable. And that is, I think, part of that intentionality that that I was referring to. I think it's a way for us to make sure that we're keeping ourselves, like I said, accountable to what we set out to do. And, you know, I I've thought about this is like, I don't want to call this a racial equity initiative. An initiative typically has a start date and an end date. And I think this is more of, this needs to be integrated into our DNA as a foundation. And I think we really are at that critical juncture, and we're moving forward with that.
And I think the foundation is ready for it. You've done a lot of the pre-work, and the pump's primed. You guys have had the conversations. You understand the impact. You've worked with community. And as I said, you just said they challenged you. This work and being able to do this not as an initiative, but a true change is going to be challenging and uncomfortable and shift us. And if it doesn't, then we probably need to wonder if we're doing it right. Right? We probably do. So as a person who not only lives their lives to do this work, but as the CEO of YWCA, I will say, thank you very much for looking at that and understanding that the investing in building the capacity of people, communities, and nonprofits to be able to do this work for a longer time is teaching, it's the teaching you how to fish concept, right? In the past, what's happened is we've put the onus and the value on how many fish you caught immediately out the gate, instead of the onus on the value on how well you have learned to fish. And have you become a really good fisherman? What did you need to do that? And how well are you steering the boat? And when we leave, are you going to be able to feed yourselves for decades or generations or years to come? And that's not as obvious a measure of outcome to say it's successful. And so it's going to challenge us to say, what does success look like when I'm teaching someone to fish?
Right.
As opposed to how many fish are in the boat. So I value that. It's sticky. I see you kind of wanted to say something. Go on, Janisse.
It's I think thinking about funders, right? And what we can do better, evaluating this type of work is not easy. It's not as if you're implementing an evidence-based program and you do a pre and post survey.
Yeah.
And I think that there's a challenge to us as funders that, one, we need to be thinking about those metrics, because they won't be quantitative metrics all the time. And we need to think about what does success look like, and also what does success look like in the long term. Many of the efforts that we're talking about here will take years and years to see. And so, that's the hard part about prevention and capacity building and policy and systems change. It's a long-term commitment. And so, evaluation is always a challenge. But I think the field overall understands that is something that we need to seriously look at as a field, and be open and flexible to other ways in which we are identifying success indicators for our organization.
Absolutely. And also giving yourself some room to realize some of the efforts will fail.
Correct.
That may not be, right? It won't have the success outcomes you want, but are there lessons, valuable lessons to be taken from that? Because we, philanthropists, nonprofits, are the only industry in the world that says, try something, but you better get 90% of it right, or else you failed, right? And you better tell me what that 90% is going to look like from day one, and I'm holding you to it in day 5.
You're welcome. We're not guilty of that.
Never. I mean, look at every other industry. Every other industry says research and development is important. We have to try things thoughtfully. Some will win, some will lose, and we're going to really hone into the lessons learned and the things that do work. And then we're going to expand on those. And that's a constant process of expansion and contraction, expansion and contraction. But we don't do that. And we work with people.
That's right. Yeah, it's such a critical role for philanthropy, right? Because we are, I think, in a place where we can take informed, measured risk,
Yes.
and we're allowed to fail, because the failure is really, as you said, there will be lessons learned so that then we can inform whether it's government or those other revenue streams that are allocating resources for the long
Yep.
term. Hey, this works, this doesn't work. And that's part of what we're trying to accomplish with our COVID disparity initiative, that I'll just very quickly mention, because it is part of what we have shifted to in terms of both our financial and our human resources currently. Since the pandemic hit, we have been allocating, obviously, resources to support emergency relief, kind of addressing the basic needs of families and individuals. But no surprise to those in public health, as soon as the data began to show what we thought it would show, which was, Blacks and Hispanics carrying a burden that is disproportionate to others when it comes to deaths, hospitalizations, we said, okay, we need to establish or launch a COVID disparity focused initiative, which really the goal there is understanding that, and I think you touched on this earlier, is we have a health crisis and we have a financial crisis. And the people that are bearing the brunt of that are our Black population and Hispanic populations. And we need to have an effort that is coordinated, data-driven, and tailored. And I think that is really the key, tailored and targeted to the particular needs and characteristics of these individuals. So when you're doing outreach, education, and engagement, you have to understand, whether they speak poor English, whether there is, fear of the medical system or healthcare system, or distrust. I mean, that's been a topic this week during the YWCA challenge, and we understand why. One of the things that we heard of our little Haiti community, North Miami, which we've heard before, but specifically to COVID, was that there were people saying, oh, we're not going to go and get tested because what they're doing is they're going to inject us with the virus. And to someone that is not familiar with the history, they will say, why would they think that? And it's like, why? Because it has happened in the past where, studies have been done on the Black population where treatments have been withheld, for example. So, and it's a whole nother issue when vaccines become available, right?
Yeah.
Will they be distributed in an equitable way? But anyways, our COVID disparity initiative is really about taking a look at these areas of vulnerability because of their social and economic conditions, partnering with trusted organizations, and then offering a tailored approach to increase their understanding and awareness of the virus, and then also testing approaches that that are more accessible. I mean, we have a high percentage of people that don't own a vehicle. So the community test site that's only drive-through is not going to solve the issue. They're also probably not, they're not insured. They don't have a primary care provider. Who do they ask these questions? So perhaps the approach there is more an on-site or at-home testing. So, again, it's we are knee-deep into looking at how do we slow the transmission of COVID? How do we keep our economy open? I think that's a must, but we must do so in a way that our workers, which you mentioned it earlier too, are, those in low wage, high contact occupations, Blacks and Hispanics, period.
Exactly.
So,
exactly. So we'd be putting ourselves into another structurally racist outcome by pushing for the economy to open, knowing who it's going to impact the most.
So, you mentioned that.
We really have to be thoughtful.
We do. just this morning, I was looking at a video from one of our news channels, and they were talking about how the administration is now blaming Black and brown communities.
I'm gonna take a deep breath.
Yes, I mean, I just thought that it's really highlighting what we're talking about, because we heard it also from our own governor, with the issue of, you know, COVID transmission in our farm workers, which is an issue that was brought forward early on, and we could have done something to stop the spread. But anyhow, at the national level, just today, the administration was basically saying the spikes are a result of protests, right? The Black Lives Matter protests. And then
That one coming.
we also share the Mexico-US border. So Mexico is seeing, you know, high cases of coronavirus, and they're bringing it in. This blaming on our Black and brown populations is really nothing new, and is what we're talking about. What is the outcome in terms of well-being, mental well-being, physical well-being for the individuals that are at the end of that message, right? So
it's unbelievable. And just the politicizing for your own goals and intent and messaging into the universe what can be such a dangerous message is so hurtful. So again, guys, I want to start wrapping us up. Janisse, I mean, we could keep going forever. I think we could keep talking, and we will. Educate yourselves. It starts with us, and that's what the 21-day challenge is. Read, listen, learn. We hope to keep bringing you information, but the challenge was this. This was a great conversation around public health, and I think just gives another layer and lens for folks to understand how that shows up in our day-to-day lives right around us, and how what you see has layers of stories behind it as to how it might have gotten to what you witness in passing someone on the street, or encountering them in the grocery store or in their neighborhoods and saying, why didn't they go? Or that person should. This hopefully will give you some lens on why things happen the way that they do and why folks respond the way that they do. So thank you for such a great conversation. I really appreciate your time and your partnership and your leadership. And we look forward to continuing to work on social determinants of health, in which racism and racial structural racism is has to be and continues to be on the forefront of our goals and our sights, because it's a long road. It's going to be quite a journey, but I think we're all geared up for it. So yay us!
Thank you, and thank you for the challenge. I think the foundation team is definitely learning, right? We knew that we had to start a learning journey, and this was definitely something that came at the right time, and has been eye-opening, as I said. I think we all just didn't realize how much there was to know.
There's a lot and still more. So thank you so much.
Thank you so much, Kerry-Ann.
You have a great weekend, and I'll see you soon.
All right. Bye-bye.
Bye-bye.